Hello, I'm Dr. Brandon Hardesty, and I'm an adult hematologist at the Indiana Hemophilia and Thrombosis Center. This presentation is a basic introduction to how hemophilia gene therapy works. An easy way to think about gene therapy is to imagine that you're going on vacation. When you go on vacation, you have to do some planning first. Some of the things you might plan are where are you going, or the destination, how will you get there, what suitcase you'll use and what you'll pack, where are you staying once you get to your destination, and how long are you planning to stay? You can think of gene therapy in much the same way. First, we decide which body tissue the gene therapy will target. This is the destination. Next, we decide how gene therapy will get to its destination. In other words, how will the gene therapy be given to patients? Then, we decide what goes in the gene therapy suitcase. This suitcase will contain the new gene and anything else that's needed for the gene therapy to start working in your body. Next, we decide where the new gene will stay in your body. And last, we determine how long the vacation will be. In other words, how long will the new gene last in your body? First, we need to decide on our travel destination. What body tissue does the gene therapy target? Right now, hemophilia gene therapy targets your liver cells because this is where clotting factor is made. By targeting the cells where clotting factor is made, we can help them make factor that works the right way. Next, you need to decide how you will get to your travel destination, like by plane or by car. For gene therapy, this is when we decide how it will be given. Right now, we give hemophilia gene therapy as a one-time infusion at a hemophilia treatment center. An infusion is when medicine is given with a needle into your vein. It takes at least an hour and sometimes longer to infuse. After the infusion, we will watch you for a few hours for safety. After deciding where you are going and how you will get there, you will need to choose a suitcase and pack it. In gene therapy, this is where we decide how to package the gene and what goes inside of it. Hemophilia gene therapy uses something called a vector to carry the gene. Think of the vector as a suitcase. Right now, the vector we use is a modified virus that is not dangerous to humans. This virus can target specific cells in your body. For hemophilia gene therapy, the vector targets liver cells. Inside the vector, there are specific genes depending on the disorder being treated. For hemophilia B, a working factor IX gene has been placed into the vector. This vector will deliver the working gene to the liver cells. All right, we've picked our destination, but now we need to decide where we will stay once we get there. For gene therapy, this means figuring out where the gene will stay in the target body tissue. The gene that is delivered to the target liver cells has instructions that will help the liver cells make clotting factor. This healthy working gene is delivered to your cells, but it stays mostly separate from your DNA. That means that you will still have the genetic mutation that causes hemophilia, so it will still be passed on to your daughters. The last step in vacation planning is to decide how long you are going to stay at your destination. In gene therapy, this step is where we look at how long the new gene will last in your body. We think that some gene therapies could be long-term and even lifelong. Others might last only a few years. It depends on the kind of gene therapy used and on the individual patient. We cannot predict this for you, but we can show you the results that other patients have had. Doing your follow-up after gene therapy will help improve the chances that it will work for you. This is why keeping up with your labs, checkups, and prescribed medications is so important. Unfortunately, gene therapy might not work for everyone. Gene therapy products have been approved by the FDA for both hemophilia A and hemophilia B. Hemgenix was the first product approved in the US and is for hemophilia B. To take gene therapy, you must meet each product's specific requirements. For example, To receive hemogenics, you must have hemophilia B and meet one of these additional requirements. You must use factor IX prophylaxis, have life-threatening bleeding either now or in the past, or have had repeated serious bleeding with no known cause. Most people treated with gene therapy have fewer bleeds and need fewer and even no factor infusions, but this varies from patient to patient. There are other hemophilia gene therapies that are being developed and are still in review at this time. There are some important things to know about what needs to happen after receiving your gene therapy. Even though it is a one-time infusion, it is a long-term commitment. There are safety requirements. You cannot drink alcohol for at least 1 year after your infusion and may only resume light drinking after that. You will need to wear a condom during any sexual activity for at least 6 months after your infusion. You will not be able to donate blood, organs, tissues, or cells for the rest of your life after gene therapy. Since it does not edit your genes, you will still pass down hemophilia to any daughters you might have. This means that your daughters will be carriers of hemophilia. Certain people cannot receive gene therapy. It is currently only for adults, so anyone under the age of 18 can only take it as part of a clinical trial. You cannot take it if you have an inhibitor now or if you have had one at any time in your life. You cannot take gene therapy if you have advanced liver problems since it targets your liver cells. And you shouldn't receive gene therapy if you cannot commit to the safety and follow-up requirements like taking steroids as needed and following the alcohol and sexual precautions. Also, it is essential that you complete all required blood draws and follow-up visits to ensure an ideal outcome. If you are interested in pursuing gene therapy, please reach out to your IHTC doctor to talk about it. You will need to be ready and willing to commit time and effort to this treatment. You'll also need to be ready for an in-depth screening. This screening will include talks with your IHTC doctor, blood work, a mental health assessment, and checking your liver and heart health. This might include scans of your liver and heart if there are any concerns. Remember that the journey of 1,000 miles begins with a single step. If you are interested in starting your journey with gene therapy, take the first step by reaching out to the IHTC to learn more and see if this treatment is right for you. This is a short and simple explanation of gene therapy. To learn more about gene therapy and whether it's the right choice for you, you can reach us at 1-877-CLOTTER. Thank you for your time.